Testosterone does increase your red blood cell mass, meaning it does increase your hemoglobin and hematocrit. This is not polycythemia. Polycythemia is a phenomenon where you have an increase in red blood cells, an increase in platelets, an increase in various white blood cell lines. It's actually a myeloproliferative neoplasm, meaning a cancer of the bone marrow. Testosterone, when it increases your hemoglobin and hematocrit above normal, that's called a secondary erythrocytosis, which is totally different and totally separate from polycythemia. Is the erythrocytosis, meaning the increased hemoglobin and hematocrit from testosterone therapy, dangerous? Well, there's some thought by most physicians and experts that the increased red blood cell mass as a result of testosterone increases your blood viscosity, and that also increases your risk for blood clots, meaning deep vein thrombosis, which can turn into a blood clot in the lungs called a pulmonary emboli. The evidence for this is very poor. The physiologic basis for this is very poor, but that's what most people think. And I think historically that's a result of confusing erythrocytosis with polycythemia. So to answer the question, testosterone does not cause polycythemia. It causes erythrocytosis. Is it dangerous is an open question. It probably isn't. Maybe it increases your risk of blood clots very, very slightly. What we do about that these days, we send people for therapeutic phlebotomy, which lowers their hemoglobin and hematocrit. The evidence that this is beneficial or that this reduces your clotting risk back to baseline is absolutely zero. But that's what most physicians and experts recommend, so that's basically the standard of care.